in-service sessions are great ways for nursing and other healthcare professionals to learn on the job. The topics could range from stress management to procedural changes that will improve patient care and various points in between. The main reason for designing and presenting in-service sessions include increasing healthcare providers' knowledge. For example, an educational talk on delaying inducing labor until 39 weeks of gestation would provide a clear rationale for why this promotes neonatal and maternal health. So the result would be improved skills, since the provider would be able to understand the rationale and educate their patients. And also, continuing education is essential to professional development and improved patient care. Not all in-service sessions have such lofty goals. More common topics include strategies for dealing with difficult patients or family members, learning to use electronic medical record systems, or revising handoff procedures during shift changes. Whatever the case, the desired outcome will include job satisfaction, self-improvement, opportunity for advancement, and improved patient outcomes. Whatever your reason for wanting to develop an in-service session, you need to begin with a plan. And this is very similar to planning any type of medical communication, where you think about what you want to do, why you want to do it, and the best method for going about it. So essentially, we define the need. Here you'll ask yourself, why do you want to do this? Why is it important to educate or help others with this? Develop objectives. What do you want your learners to be able to do with the information you will provide? Determine a format. What's the best way to disseminate this information? Should we have handouts? Should we present a lecture? Should we have an interactive demonstration? Should we have a bit of each? And then produce the materials. So that's where all the above elements come together in the manner that you've decided will be most effective. As you may have guessed with on-the-job learning, the job doesn't stop just because an in-service session is going on. You'll also need to consider aspects like who should attend. Is attendance mandatory? Will the session be held during work hours? Since most of them are, you'll also have to think about who will look after the patients during the session. You may need to have more than one session so that everyone who must attend can be there. If you're not holding it during work hours, bear in mind that people have lives outside of work. So will they be compensated for their time? If not, you'll need to emphasize the potential benefits of attending. As you may know, most healthcare professionals must have a certain number of educational credits each year to renew their professional licenses. In some cases, but not all, in-service sessions may qualify for continuing education or continuing medical education units. Topics that are expressly designed to improve patient care or public health often qualify. The general standard is that the content must have measurable learning objectives which will enhance practice, education, administration, research, or theory development that will improve patient care or public health. Going back to our previous examples, the in-service about inducing labor after 39 weeks of gestation would definitely qualify for educational credits because one could measure the outcome, such as reduced time in the neonatal ICU. An in-service about stress management would probably not qualify. That doesn't mean you shouldn't have an in-service about stress management, because it is an important part of job satisfaction and productivity. It just means that particular topic wouldn't be considered continuing education for licensing purposes. Now, you don't have to memorize all the licensing board's rules for what does and doesn't qualify. Most hospitals have a continuing education office which uses an application process to determine eligibility. If it doesn't, it may be affiliated with an accreditation provider, with an accredited education provider who could also be of service. So the application would ask similar questions to the ones posed earlier on in this presentation. Will you define a gap between what the learners currently know and what they'll learn. You'll provide learning objectives, and you'll include a rationale for holding the session. Answering the question, why do they need to know this? Now, back in the very first week, we reviewed the principles of rhetorical analysis, and you'll be doing the same thing when you plan an in-service session. You're asking, what is the difference between your perspective and your reader's perspectives, and how does the difference affect where and how you look for solutions? Once you've answered those questions, you're ready to think about how you can best bridge the gap. That involves developing objectives. What is it that you want your learners to be able to do? For example, let's suppose your in-service will review changes in patient discharge procedures, so your facility complies with new national guidelines. There's a gap between what your learners knew about the old non-compliant procedure and what you want them to be able to do, which is follow the new compliant procedure. So your learning objectives could be written as follows. At the conclusion of this in-service session, attendees will know how to reconcile the patient's discharge plan with national guidelines, refer patients to post-discharge services, provide each patient with a written discharge plan, and assess the patient's understanding of his or her discharge plan. Alright, at this point we've defined the need and developed objectives. Now what? Now it's time to determine the format. What's the best way to get this message across to your audience? You may have to work within certain constraints, such as time or budget. For instance, your message may be more memorable if you create a video with actors modeling the discharge plan and a professional narrator reviewing the most important points, but these are expensive to produce and time-consuming to make. But that doesn't mean you can't still create a memorable in-service. You can still use multimedia if you think it's the best way to help your learners remember, but other formats like presentations, hands-on activities, and handouts may work just as well. Producing the materials. Now, try not to do too much in your in-service session. I mean, no one's going to set out to win the Nobel Prize in Medicine by attending the session, so stick with what your audience really needs to know. Session time is limited, so be sure to present the most important information first. It's very inefficient to save the best for last. When you're producing your materials, put yourself in the audience's place. What will their attitudes toward the topic be? Will you need to quell any negative or hostile feelings? What kinds of questions might they have? By anticipating those questions and answering them during the course of the session, you can make it more informative and save everyone time. Studies show that most adult learners only retain about 20% of the information they hear, so a handout for future reference could be a very valuable tool. When you're presenting, have realistic expectations. In-service sessions are not just about you, they are about the learners as well. You've probably heard the expression that you can lead a horse to water, but you can't force it to drink. Similarly, you can present the best educational session in your organization's entire history, but the learners need to motivate themselves to learn. You can help them feel motivated by answering their implied questions at the beginning of the session, like, why do I need to know this? Why should I care? How is this going to help me? If you can find a way to involve your learners in the process, such as participating in a demonstration or completing an activity, you may find it helps them to understand and remember the information. And finally, remember bridging the gap. In-service sessions generally begin with a problem and focus on a solution. By helping your learners perceive that the problem affects them and that your solution solves it, you're much more likely to have a successful educational session.